Do your eyes feel dry, gritty, or burn after a long day at the computer? You're not alone. More than 16 million Americans deal with dry eye syndrome, and it's only getting worse with our screen heavy lifestyles. So, what exactly is dry eye syndrome? Simply put, it's when your eyes don't produce enough tears or the right quality of tears to keep your eyes comfortable and healthy. Think of tears as your eye's natural moisturizer and protector. When this system breaks down, everyday activities like reading, driving, or even watching TV can become uncomfortable challenges. Here's a statistic that might surprise you. Between 16.7 and 50.2 million Americans currently live with dry eyes. This is between 5 to 15% of the population. Women are hit particularly hard, experiencing dry eyes about twice as often as men. And with our increasingly digital world, these numbers are only growing. The condition isn't just about discomfort either. Dry eye syndrome costs the US economy over $55.4 billion annually, affecting productivity and quality of life for millions. But here's the good news. Understanding this condition is the first step toward managing it effectively. That's exactly what we're here to do today. We'll walk through everything you need to know about dry eye syndrome, from what causes it to how it's treated, and most importantly, what you can do about it. Knowledge is power, especially when it comes to your eye health. Let's dive into what actually causes dry eye syndrome. Understanding the why can help you better manage or even prevent this condition. At its core, dry eye happens for two main reasons. Either your eyes don't make enough tears, or the tears they do make aren't good quality. Imagine your tear film as a three-layer cake. You've got an oily layer on top, a watery middle layer, and a mucus layer at the bottom. When any of these layers gets disrupted, problems begin. The first type is called aqueous deficient dry eye. This is when your tear glands, called lacrimal glands, simply don't produce enough of that watery middle layer. Think of it like a faucet that's been turned down too low. The second and more common type is evaporative dry eye. Here, your eyes make plenty of tears, but they evaporate too quickly. The culprit? Usually something called meibomian gland dysfunction. These tiny oil glands line your eyelids like little factories, producing the oils that keep your tears from evaporating too fast. When these glands get blocked or don't work properly, which happens more as we age, your tears disappear like water on a hot sidewalk. Environmental factors play a huge role too. Low humidity, wind, dust, and even air conditioning can accelerate tear evaporation. Certain medications, antihistamines, decongestants, blood pressure medications, can also reduce tear production as a side effect. And here's something many people don't realize. Our digital lifestyle is a major contributor. When we stare at screens, we blink less frequently and less completely, which means our tears don't get distributed properly across the eye surface. Some people are simply more likely to develop dry eye syndrome than others. Let's break down these risk factors so you know what to watch for. Age is the biggest non-modifiable risk factor. As we get older, our tear production naturally decreases, and those oil-producing meibomian glands become less efficient. If you're over 50, your risk increases significantly. Gender plays a major role as well. Women face about twice the risk of developing dry eyes compared to men. Hormonal changes during menopause, pregnancy, or from birth control pills can all affect tear production. Certain medical conditions can set you up for dry eye problems. Autoimmune diseases like rheumatoid arthritis and Sjogren's syndrome top this list. Diabetes is another big one. Studies show that 67% of diabetic patients experience dry eye symptoms. These conditions can affect the nerves that control tear production or cause inflammation that disrupts the tear film. Your lifestyle choices matter too. Spending long hours in front of computers or digital devices significantly increases your risk. Contact lens wearers also face higher odds as lenses can interfere with the natural tear film. Smoking is another modifiable risk factor. It can worsen dry eye symptoms and slow healing. Environmental factors you can often control include living in dry, windy climates or working in air-conditioned environments. Even your job matters. Farmers and outdoor workers face higher risks due to dust and wind exposure. Many of these risk factors are things you can influence through lifestyle changes, which we'll explore later. Dry eye symptoms can be sneaky. They often start mild and gradually worsen, making it easy to dismiss them as just tired eyes or getting older. Let's walk through what to watch for. The most obvious symptom is, well, dryness. Your eyes might feel gritty or sandy, like someone sprinkled tiny particles under your eyelids. Some people describe it as a burning or stinging sensation that comes and goes throughout the day. Here's something that confuses many people. Watery eyes can actually be a sign of dry eye syndrome. It sounds backward, but when your eyes are irritated from dryness, they sometimes overcompensate by producing too many tears. But these are poor quality tears that don't stick around long enough to help. Vision problems often creep in gradually. You might notice intermittent blurry vision, especially when reading or using a computer. Some people see glare or halos around lights, particularly at night. It's like trying to look through a smudged window that keeps fogging up. Your eyes might feel tired more easily than they used to. Activities that never bothered you before, like reading a book or watching a movie, suddenly leave your eyes feeling exhausted. Some people describe their eyelids as feeling heavy or difficult to keep open. Redness is another common sign, though it can come and go. Your eyes might look irritated or bloodshot, especially later in the day or after screen time. As symptoms progress, you might develop sensitivity to light, wind, or air conditioning. Contact lens wearers often find their lenses becoming increasingly uncomfortable or impossible to wear for long periods. Um, the key thing to remember is that these symptoms tend to worsen throughout the day and with certain activities. If you notice a pattern like your eyes feeling worse after computer work or in air conditioned rooms, that's your body giving you important clues. Getting a proper diagnosis for dry eye syndrome involves several steps, but don't worry, most tests are quick and painless. Let's walk through what you can expect when you visit an eye care professional. Your doctor will start with a detailed conversation about your symptoms. They'll want to know when your eyes bother you most, what makes them feel better or worse, and what medications you're taking. This detective work helps them understand your specific situation. Next comes a comprehensive eye exam. Your doctor will examine your eyelids, looking for signs of inflammation or blocked oil glands. They might gently press on your eyelids to see how well your meibomian glands are functioning. Think of it as checking if those tiny oil factories are doing their job. One of the most common tests is called tear breakup time, or TBUT. After placing a tiny drop of harmless orange dye in your doctor watches how long it takes for your tear film to develop dry spots. Normal tears should stay stable for at least 10 seconds. If they break up faster, it suggests your tear quality isn't optimal. The Schirmer test measures how much tears your eyes actually produce. A small strip of paper is placed under your lower eyelid for about 5 minutes. It's like a tiny measuring stick for your tears. While it might feel slightly uncomfortable, it's not painful. Many doctors will also have you fill out a questionnaire called the OSDI, Ocular Surface Disease Index. This helps quantify your symptoms and track improvements with treatment. It's like a report card for how your eyes are feeling. The entire diagnostic process usually takes about 30 to 45 minutes, and most tests provide immediate results. The good news about dry eye syndrome is that there are many effective treatment options available. The key is finding the right combination that works for your specific situation. Let's start with the most common and accessible treatment, artificial tears. These over-the-counter eye drops work like a replacement for your natural tears, providing immediate moisture and lubrication. Think of them as a drink of water for thirsty eyes. The trick is choosing the right type. Preservative-free drops are usually better if you need to use them more than 4 times a day. For more persistent cases, prescription eye drops can make a significant difference. Anti-inflammatory drops like cyclosporin help reduce the inflammation that often accompanies dry eye. These take several weeks to show full effects, but they can provide long-term improvement rather than just temporary relief. Lifestyle modifications can be surprisingly powerful. Simple changes like taking regular breaks from screen time, following the 20-20-20 rule, where every 20 minutes you look at something 20 feet away for 20 seconds, can help tremendously. Using a humidifier in your home or office adds moisture to the air, giving your tears less opportunity to evaporate. Warm compresses are another effective home treatment. Applying a warm, damp cloth to your closed eyelids for 10 to 15 minutes can help unclog those oil glands we talked about earlier. It's like giving your eyelids a gentle massage to get things flowing again. For more severe cases, your doctor might recommend punctal plugs. These tiny devices are inserted into your tear ducts to prevent tears from draining away too quickly. Advanced treatments include intense pulsed light therapy and radiofrequency treatments, which can help restore proper oil gland function. These newer options show promising results for people who haven't found relief with traditional treatments. The key to successful treatment is patience and persistence. Most treatments take time to show their full effects, and finding the right combination might require some trial and adjustment. While you can't prevent all cases of dry eye syndrome, there are many practical steps you can take to protect your eyes and manage symptoms effectively. Let's start with your daily habits. If you work at a computer, position your screen slightly below eye level. This reduces the surface area of your eyes exposed to air, helping prevent tear evaporation. It's like creating a natural shield for your eyes. Blinking might seem automatic, but many of us don't blink completely when we're concentrating. Make a conscious effort to blink fully and frequently, especially during screen time. Your environment matters tremendously. Avoid sitting directly under air conditioning vents or fans. If you must be in windy conditions, consider wraparound sunglasses to create a more humid microenvironment around your eyes. It's like creating a protective bubble for your eye area. Diet can play a supporting role too. Some studies suggest that omega-3 fatty acids might help with tear production, though the evidence is mixed. Staying well hydrated throughout the day supports overall eye health. Think of it as keeping your body's moisture reserves topped up. Regular eyelid hygiene is crucial, especially if you're prone to blocked oil glands. Gentle cleaning with diluted baby shampoo or specialized eyelid scrubs can prevent buildup that leads to gland dysfunction. It's like regular maintenance for your car. A little prevention goes a long way. Consider your medications with your doctor. If you're taking antihistamines, decongestants, or other drugs that can dry out your eyes, ask about alternatives or timing adjustments. Creating good sleep habits helps too. Poor sleep can worsen dry eye symptoms, so aim for 7 to 8 hours of quality rest. Your eyes do important repair work while you sleep. Finally, don't ignore the importance of regular eye exams. Early detection and treatment of dry eye syndrome can prevent it from progressing to more severe stages that are harder to manage. Living with dry eye syndrome affects much more than just how your eyes feel. It can reshape how you navigate your entire day. Let's explore the real-world impact this condition can have. Driving can become challenging, especially at night when glare from headlights creates halos and starbursts. Many people with dry eyes find themselves avoiding nighttime driving or feeling less confident behind the wheel. It's like trying to navigate through a slightly fogged windshield that never quite clears up. Reading, whether books, newspapers, or computer screens, often becomes more difficult. Your eyes might tire quickly, words might blur, or you might find yourself taking frequent breaks. Some people describe it as their eyes giving out after just a short time when they used to read for hours without problems. Work productivity can suffer significantly. If your job involves computer use, you might find yourself less efficient or more fatigued by the end of the day. The constant discomfort can be distracting, making it harder to focus on complex tasks. Social situations aren't immune either. Smoky environments, air-conditioned restaurants, or outdoor gatherings on windy days can all trigger symptoms. Some people find themselves avoiding certain activities or locations they once enjoyed. Sleep quality might decline too. Dry eyes can feel worse in the morning upon waking, and severe cases might even wake you up during the night. It's like your eyes never get a proper rest, even when the rest of your body does. The emotional impact shouldn't be underestimated. Chronic discomfort can lead to frustration, anxiety about activities that might trigger symptoms, and even depression in severe cases. It's the kind of condition that touches every aspect of daily life. However, there's hope. Many people successfully adapt by using adaptive tools like computer screen filters, adjustable lighting, magnifying apps on their phones, or specialized glasses. The key is recognizing that dry eye syndrome is a legitimate medical condition that deserves attention and treatment, not something you just have to live with. We've covered a lot of ground today, from the basic mechanics of how dry eye syndrome develops to the impact it has on our daily lives. Here are the key takeaways to remember. Dry eye syndrome is incredibly common, affecting millions of people worldwide. It's not just an inconvenience, it's a legitimate medical condition that can significantly impact your quality of life. The good news is that it's also very treatable, especially when caught early. Whether your dry eyes stem from too much screen time, hormonal changes, medical conditions, or simply getting older, there are effective solutions available. From simple artificial tears to advanced therapies, the treatment toolkit keeps growing. Remember that small changes can make a big difference. Taking screen breaks, using a humidifier, wearing wraparound sunglasses in windy conditions, and practicing good eyelid hygiene are all simple steps that can provide real relief. Most importantly, don't ignore persistent eye discomfort. If your eyes regularly feel dry, gritty, or tired, or if your vision seems less clear than it used to be, it's time to talk to an eye care professional. Early intervention can prevent symptoms from worsening and help you maintain the clear, comfortable vision you deserve. Your eyes work hard for you every day. They deserve the same attention and care you'd give any other important part of your body. With the right knowledge, treatment, and ongoing care, you can keep enjoying all the visual experiences that make life rich and meaningful. Don't let dry eye syndrome dim your world. Take action, stay informed, and remember, clearer, more comfortable days are absolutely within reach.